Chapter 8, Clinical Information Systems. A clinical information system, or CIS, collects and stores medical, nursing, clinical ancillary areas, such as radiology and laboratory, and therapy department information related to patient care. Data contained within the various information systems are patient identifiable and are therefore protected by the HIPAA Act. The clinical data stored within the CIS are used to diagnose a patient's condition, make treatment decisions, monitor the current condition, and manage overall care. The CISs discussed in this chapter are the Document Management System, or DMS, Radiology Information System, or RIS, Laboratory Information System, or LIS, Nursing Information System, or NIS, Pharmacy Information System, or PIS, Interdisciplinary Charting System, Emergency Department System, Anesthesia Information System, Patient Monitoring System, as well as Telehealth and smart cards. A document management system is an electronic method of capturing and managing documents. The DMS is used primarily by health information management departments and other departments to handle documents regarding patient care. These documents can be scanned or obtained electronically from other information systems. Document capture is much more than scanning paper images into the DMS. Voice, video, electronic transactions, and other forms of technology may be used to capture data. One example is the optical character recognition, or OCR. OCR is defined as a method of encoding text from analog paper into bitmapped images and then translating the images into a form that is computer readable. With OCR, a text can be scanned and the content can be edited. Document indexing, barcoding, and character and form recognition are ways to link documents to a particular patient, thus allowing for retrieval. An index is an organized, usually alphabetical list of specific data that serves to guide, indicate, or otherwise facilitate reference to the data. These indexing tools allow the user to locate and retrieve a specific patient's health record, a specific encounter, and even a specific document through the use of indexing by entering search criteria into one or more of the index fields. The DMS is not the same as an electronic health record. The EHR is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and can be created, managed, and consulted by authorized clinicians and staff across more than one health organization. In a DMS, the image can be retrieved by any authorized user from any location. Multiple users can also view the same image at the same time, enhancing communication between care providers. The image of the scanned document cannot be searched, edited, or changed unless OCR is used. Many of the healthcare facilities that elect to implement a DMS use it as a component of the EHR. A DMS is made of many components, including a scanner, magnetic storage, and file server. All of the components work together to scan, store, and retrieve the health information. The scanner is the hardware that is used to transform the paper documents into a digital image. Scanners are rated based on the number of pages per minute, or ppms, that the scanner can process. Target sheets are pages that contain only a barcode that tells the scanner and ultimately the computer the content of the pages that follow. The scanning workstation is the desktop computer that controls the scanner. Once a document is scanned, the workstation compresses the file created by the scanner in order to save storage space. Another step performed by the scanning workstation is to give each document scanned an individual file name. The name is used to store the image and is ultimately used again when the file is retrieved. The abstracting and quality control workstation is also a personal computer. Rather than scanning, this workstation is used for indexing and quality control. The healthcare facility determines the data elements to be indexed based on its needs. During the quality control process, the clerk views every image to check for the quality of the image and to verify that the indexing is accurate and patient demographics are correct. The file server is a large PC or other computer that is extremely powerful and has a large amount of memory and magnetic hard drive. The file server receives the request for the document images, retrieves the document images, and sends the document images back to the requester. The retrieval workstation is the workstation used by the physician, HIM staff, or other users to retrieve patient information and view document images. Finally, the printers. The healthcare facility will need to determine who has rights to print reports from the DMS system. There must be an electronic or computerized print tracking log, similar to an audit log, that indicates who requested or submitted the print order, where the printing occurred, which printer was used, and in what area of the healthcare facility, as well as the date and time of printing, what forms or reports were printed, and any other pertinent information the healthcare facility deems appropriate. Annotation. One of the functions of a DMS is the ability to annotate the images. Annotation is the ability to add to the image in some way. Because the image may be a legal document, the image itself cannot be altered. However, an overlay to the document will show the annotation. There are several ways to annotate a document. The Note tool. The Note tool will allow the physician or other user to add a note to the image. Highlighting. Highlighting tool emphasizes important sections of the text. And the Drawing tool can be used to draw circles, arrows, or other markings. There is also a Zoom and Reduction tool to enlarge or reduce the size of the image in order to enhance it for viewing. And finally, the Rotate tool allows the user to flip an image. This is useful if a document has been scanned upside down or sideways. There are many advantages and disadvantages to the DMS. Some advantages are space savings, productivity gains, and immediate access to patient information. Disadvantages include lack of manipulation and reporting capabilities, as well as fear of change to work processes. Backscanning is the process of scanning past health records into the DMS so there is an existing database of patient information. The healthcare facility should choose how far back to go with the scanning, such as 6 months or 2 years. Record scanning can be performed by the healthcare facility, HIM, or other designated staff, or it could be outsourced to a vendor. Healthcare facilities must justify the cost of DMS with the savings that occur from decreasing the operating costs of the HIM department and healthcare facility as a whole. Forms management is a key implementation issue that must be addressed. There also may be staffing changes, process redesign, and a determination as to when to scan the health record. Some healthcare facilities scan the health record immediately following discharge. Other healthcare facilities complete the health record, obtaining all necessary documents and signatures, and then scan it. The Radiology Information System is used to collect, store, and provide information on radiological tests such as X-rays, ultrasound, MRIs, CT scans, and positron emission tomography or PET scans. The RIS also supports other radiological procedures performed in radiology, such as ultrasound-guided biopsies and upper and lower GI series. An RIS is designed to assist the technician by identifying the steps required to prepare for each test or procedure. An RIS can also provide patients with follow-up instructions to take home after the procedure. In addition, the RIS can perform many administrative tasks. It can schedule patient examinations and procedures, report charges to the financial information system, generate management reports, generate radiology reports, track nuclear materials, even transcribe documents. It can retrieve test results and fax radiology reports to the ordering physician. Also, it can monitor the supply inventory. A radiology information system frequently has a picture archival communication system, or PACS. A PACS is an integrated information system that obtains, stores, retrieves, and displays digital images. X-rays, MRIs, mammograms, and other radiological examinations, such as cardiac catheterization films and ultrasounds, are stored digitally, thus eliminating the need to store and manage the physical film. The ability to view radiology images from any location by the radiologist and other users is called teleradiology. The images can be viewed at multiple locations at the same time. A radiologist can read images from home in the middle of the night from another city or even from other countries. Teleradiology is also used frequently for consultations between radiologists who are in distant locations. The Laboratory Information System collects, stores, and manages laboratory tests and their respective results. The LIS can speed up access to test results through improved efficiency from various locations, including anywhere in the hospital, the physician's office, or even the clinician's home. The physician order for a laboratory test is generally received from a CPOE or other order entry system. The CPOE identifies what tests need to be run, schedules them, and creates a list that indicates where the patient is located and if the test is routine or urgent. Other functions include identifying normal ranges for each laboratory test, generating laboratory reports, notifying laboratory staff and physicians of panic, which are very high or low values, via alerts such as an audible ping or alarm, print barcode labels to track specimens, and submit charges to the financial information system. The Nursing Information System assists in the planning and monitoring of overall patient care. An NIS will document the nursing care provided to a patient. Clinical documentation is any manual or electronic notation or recording made by a physician or other healthcare clinician related to a patient's medical condition or treatment. There may be different NISs available for the emergency department, intensive care areas, or other nursing areas because of the differing needs of each specialization. Advantages to NIS include reduction in costs of providing nursing care, improved patient care, immediate access to information on services rendered by the nursing staff, immediate notification of results from laboratory, radiology, or other ancillary departments, reduction in lost charges, reduced average length of stay, and submits charges to the financial information system. Nursing documentation traditionally includes an admission assessment, nursing activities, intake and output, graphic information, activities of daily living, nursing care plans, nurses' notes, and the medication administration record. The NIS can also assist in the administrative management and daily operations of the nursing department by monitoring staff allocations, scheduling nursing staff, and generating performance improvement reports. A pharmacy information system, or PIS, assists providers in ordering, allocating, and administering medication. With a focus on patient safety issues, especially medication errors, the PIS is a key tool in providing optimal patient care. Data contained within the hospital information system and the functions of the PIS help providers reduce medication errors by using the hospital information system, the EHR, and the PIS, combined with information from medical databases and drug formularies. PISs can check for drug interactions, food and drug interactions, and other contraindications. The PIS can also manage the inventory of drugs in the pharmacy. This includes ordering drugs, inventory control, managing the formulary, tracking the costs of drugs, reporting on the usage of controlled medications. A formulary, by the way, is an official list giving details of medicines that may be prescribed with both the generic and brand name. It also gives a list of the drugs with the greatest value. This list changes from time to time. The PIS can assist in the dispensing of medications in the pharmacy, which can help the nursing units in a number of ways. Create individual dosages, use of secure storage systems, robotics, secure access to medications, documentation of medications administered, including when and by whom, and barcodes. The pharmacy can also analyze data stored within the information system, such as looking for patterns of drug usage and signs of abuse. These patterns may identify potential abuse by patients or physicians. An interdisciplinary charting system can be used by any healthcare professional to collect and store patient assessments, progress notes, and care plans. Examples of these healthcare professionals include physicians, nurses, physical therapists, respiratory therapists, pharmacists, dietitians, and the like. The Emergency Department System, or EDS, is designed to meet the unique needs of the emergency department, including tracking patients from triage to discharge. The EIS is also able to record test results and other clinical information. Demographic information is obtained from the Hospital Information System. This information system has become increasingly important in population health reporting. There is a need to notify state health authorities regarding diagnoses of newly emerging diseases, such as Zika virus infection or multi-drug resistant tuberculosis, or injuries due to mass casualty events such as terrorist bombings or train derailments, and injuries due to natural disasters such as tornadoes and hurricanes. An anesthesia information system collects information on pre-op, operative, and post-op anesthesia-related clinical information. This system follows the patient through the surgical process. The information system collects information on risk factors, vital signs, type of anesthesia, anesthetic agents used, dosage of anesthetic agents, and much more. The patient monitoring system automatically collects and stores patient data from various information systems used in healthcare. Data collected include fetal monitoring, vital signs, and oxygen saturation rates. Patient monitoring systems are typically utilized in the intensive care units and other specialty areas such as the operating and recovering rooms. Telehealth, also known as telemedicine. Telehealth has two aspects: professional services given to a patient through an interactive telecommunications system by a practitioner at a distant site, or a telecommunications system that links healthcare facilities and patients from diverse geographic locations and transmits text and images for medical consultation and treatment. Benefits of telehealth include improved access to healthcare, such as specialty consultations, biomedical monitoring, and second opinions. It improves the continuity of care, patient education, and timely treatment. Follow-up visits for chronically ill patients, reduced travel time for all involved, and increased care to underserved areas. This all adds up to cost efficiency, decreasing admissions, and shortens length of stay as well. Additional benefits include improved access to health records and patient information with online health information available for learning, peer support groups, and research information. improve training and education opportunities for medical and clinical personnel, as well as for patients, clinical trial research, improved interactions with medical personnel for disease management. Telesurgery is the use of robotics to perform surgery. Tele- the technology used includes virtual reality and robotics, which may be used to assist with the examination or treatment of a patient. Surgery is able to be performed on a patient in a completely different location. Issues that healthcare facilities need to consider when developing or using telemedicine, which is a subset of telehealth that focuses on the provision of care, whereas telehealth includes administrative uses and education programs. These issues apply to both. Privacy, confidentiality, and security must be ensured during the telemedicine event. Liability is usually shared between the referring provider and consulting provider. But for telemedicine vendors and technical staff, there is no legal precedent yet. Licensure and accreditation rules differ by states. There is no federal legislation for telemedicine at this time. Other telehealth issues include fraud. Policies and procedures must be developed and agreed to by all parties, and the documentation requirement for patient information and services is still provided. A smart card is a plastic card similar in appearance to a credit card with a computer chip embedded in it. Smart cards have been widely adopted for use in banking, retail, government, and other applications. Three uses of smart cards in healthcare are emergency treatment, reducing fraud and abuse, and reducing administrative costs.